You're listening to Health Professional Radio, and my guest joins me today from Australia. He is Ben Wilson, co-founder and CEO of Medical Travel Companions. Ben, welcome to Health Professional Radio.
Great. Thank you very much for having me.
Now, Ben, we had a chat, I guess it must be a year or 18 months ago, but for most people who, may not remember when we chatted earlier, tell us a little bit about what it is that Medical Travel Companions do and where it is you do it.
Yeah, thanks very much. Yeah, look, Medical Travel Companions is all about helping people to achieve their travel dreams. So we offer 7 levels of service, anything from a travel nanny right through to a paramedic or a nurse, to assist people during a journey. So it could be point to point, as simple as picking someone up from a hospital or an aged care facility and taking them to a medical appointment, or it could be picking them up from home, taking them to the airport or a dispatch lounge, or going on an entire holiday with them for a 3-week cruise. And offering very basic medical support. We don't want to be seen as an air ambulance or everyone's got to be fit to travel, but it offers reassurance and assistance for when people travel. We also offer an airport concierge service. We have airside access in Singapore at Changi Airport, where we can do a meet and greet service and assist people, especially elderly people, moving from in transit from one gate, so we can potentially pick them up at gate 20 and sort of walk with them and look after them for the 4 hours and make sure they get on the next flight through to London or wherever it is. So
now, Ben, this is not your medical evacuation in an emergency service. This is for people who are generally, as you say, fit to fly, but are looking for some support.
Yeah, exactly. That's right. So it's we don't want to. It's not about that. This is more of a positive spin. It's about people who may be sitting at home, might be thinking, can afford to travel, and can afford to take someone with them to give them that little bit of reassurance. So it's a positive spin. And they've obviously got to be fit to fly and fit to travel, and then we can dispatch a good person with them who's clinically trained to help them on their journey. So it could be simple as flying mum or dad up for Christmas or Easter to have, and when siblings are too busy to do that, and it's cheaper for them to pay for someone like our service to travel with their elderly parents to get them from point A to point B on an aircraft. So, or it could be on a train or a bus or whatever. So that's really the essence. So it's we also have our key affiliate partners are the airlines. So we have arrangements with Singapore Airlines, Virgin Australia, Travel Associates, which is part of the Flight Centre, Abercrombie and Kent, and organisations like NRMA Travel, RACQ, RAA. So we've got quite a lot. We've got a live web app system that is on these key affiliate partners' websites, which enables us to track all of the inquiries and bookings. So an ever-evolving business, and we operate now globally from offices in London, Sydney, Singapore, and Australia.
I see. Now, Ben, most of our audience are clinicians of one kind or another. A lot of them work in acute care in hospitals, and a lot work in aged care. What's the message you'd like them to hear today as a result of you being on Health Professional Radio?
Yeah, it's really about we can offer assistance to some of your patients or clientele who need some level of reassurance and assistance in travelling from point A to point B. Now, that could be a short journey or it could be a long journey. It could be a young family. We've had young families that need to get from Hong Kong to New York. We have dispatched a travel nanny with them because one of the children had a mental health issue. So, or it could be taking grandma from home to the dental appointment or from home on a short trip that just needs assistance and reassurance, and we do that with qualified nurses and paramedics or travel nannies.
And I guess for a lot of people who are clinicians in those environments, you'd be happy to talk to them if they had concerns about travelling and patients and were looking for some advice about just what you can offer.
Yeah, absolutely. So we've got our terms and conditions, of course, and as I said before, everyone's got to be clinically fit to travel and signed off by their medico for us to take them, because that's obviously important for us. We don't want to take people who shouldn't be travelling. And really the best way is obviously look at our website, www.medicaltravelcompanions.com, or just simply send us an email on info@medicaltravelcompanions.com.
Now, my favourite question, Ben, and for listeners, if you've just joined us, I'm talking to Ben Wilson, the co-founder and CEO of Medical Travel Companions, and I'm just about to ask my favourite question in every interview. Ben, in every business there are misconceptions. What are the misconceptions amongst your customers, clients, patients, the misconceptions that drive you nuts and keep you awake at night?
Nothing really keeps me awake at night, really, but it's, I suppose the word medical travel companions almost anticipates that we are an air ambulance service taking full clinical responsibility, which is something that we don't, and we don't want to get into that space. But we needed to call it medical travel companions because we are obviously offering trained, qualified clinicians to do our work who, would otherwise be working in a hospital environment or a clinical environment. But they do this part-time and for really something different. So I think the word medical travel companions, sometimes people think it's for really sick people. In actual fact, it's not. It's about using clinical qualified staff to help people achieve their travel dreams and enable them to travel when they wouldn't have otherwise had that opportunity. We've had our nurses, etc., on 3-week cruise ships with an interconnecting room, looking after an elderly couple, and going around the whole of the West Indies or the Caribbean. So we've done many jobs to that effect.
Well, Ben, let's hope we can dispel some of that misconception today amongst our audience.
Yeah. No, thank you very much. Di, but it's we're getting a lot of interest out there. There's not a lot of no one else really doing what we're doing. So it's we have very close relationships with the travel, airline and cruise ship business and also the travel insurance businesses now. So
it does sound like a unique service. So Ben, let me give that website again for people who may have missed it before. It's www.medicaltravelcompanions. That's all one word, so it's quite a string of letters. medicaltravelcompanions.com. And there you'll be able to contact Ben Wilson, co-founder and CEO of Medical Travel Companions. And the terms and conditions are on the website, along with a raft of other information. And you can also make arrangements to contact Ben and get more advice and information if you need it. If you just joined us today and missed my conversation with Ben, the good news is we have on our website a transcript of the whole conversation. You can also listen to the interview as an audio file on both YouTube and SoundCloud, and we have links to get to all of those on the station website at www.hpr.fm. Ben, I do appreciate your time today. I realise you're a busy person. It's always good to have a yarn to you on Health Professional Radio.
Great. Thank you very much for having me once again.
It's a pleasure. You're listening to Health Professional Radio. My name is Wayne Bucklar.